knocked on the door. I'm entering the patient's room. I'm performing hand hygiene. I am greeting my patient. Hello, Mr. Williams, how are you today? And he tells me he is doing well. And I explained to him, sir, I am here to give you your inhaled medication. It's your Advair, which is a dry powder inhaler. And he tells me that that's fine with him. I have already done my first 2 checks of the 3 checks we need to do for medication administration, and so I am going to do my 3rd check. I start my 3rd check by identifying the patient. So I ask him, sir, can you please tell me your name and date of birth? And he tells me DeAndre Williams, date of birth 12/12/19XX. I verify it on the armband, and I scan the armband. And I also look over here on the EMR, the electronic medication administration record, and I see it says DeAndre Williams, date of birth 12/12/19XX, so I know I have the right patient. I ask him, Mr. Williams, do you have any allergies? And he tells me no. I verify he has no allergies. And so now I am going to check my medication. So I look at my MAR for DeAndre Williams. I have Advair. Advair is 2 different medicines together. It is fluticasone and salmeterol. I check the doses, 100 micrograms and 50 micrograms. He's going to get 1 puff, and he will do that inhaled daily at 9 a.m. and it is 9 a.m. And then I'm going to scan the medication. So now I have completed my 3rd check, and I'm ready to administer the medicine. So I'm going to explain to my patient how to take this kind of medicine. So sir, when you take your Advair at home, it's the purple discus. The first thing that you have to do is you open it. Once it's opened, you'll see right here on the side, right here, there's a little lever, and you're going to press that lever down, and it's going to activate the powder and make it available for you so that you can breathe it in. So I press the lever, and it activates the powder, and now my patient is going to make a nice tight seal around the mouthpiece, which is right here. So sir, make a nice tight seal, and now the kind of breath he needs to take is a fast, deep breath. A big, fast, deep breath. So breathe in quickly and forcefully, because you have to activate that powder and get it up in the air and down into the lungs, and then hold your breath for about 5 seconds, as long as you can, and then you can breathe out. For this type of inhaler, usually the dosage is 1 puff. So once my patient has finished with his 1 puff, I am going to close this back up, and then I'm going to return it to the medication room. And I will notice right here on this discus, it tells me how many puffs are left, so that I'll know when I need to order another discus for him. And that's all for administering a dry powder inhaler.